My name is Candace Cunningham. I am a person with lived experience with cerebral palsy and IDD. I'm on multiple boards like Missouri FC, Summer Future Foundation, and Missouri Mental Health Foundation. This season on Candace's Corner, we're interviewing awesome people who have been in the field and to learn about the history of developmental disability in Missouri. I get the awesome pleasure to interview today Duane Shumate, and we're going to learn about the history of employment in Missouri. Hi Duane, how are you?
Wonderfully, Candace. It's an honor, and I'm truly humbled to share a little time with you in Candace's Corner.
Yeah, thank you. Duane, could you tell us a little bit about yourself and what you do now and how it brought you here?
So, I retired about 2 years ago from the state of Missouri. I had worked with the state for a little over 30 years as a vocational rehabilitation counselor, a district supervisor with Missouri Division of Vocational Rehabilitation. Worked on several of their statewide teams around developing programming and services for individuals with disabilities as it related to employment programming and services with the community agencies. In 2014, I moved over to the Department of Mental Health and was the State Director of Employment and Community Engagement for the Division of Developmental Disabilities. Loved that job. Did that for about 11 years and then retired from the state about 2 years ago. And since then, I've created a consulting business, and I consult with community providers here in Missouri. I also work with state agencies outside of the state of Missouri, kind of throughout the nation. And then also do some work with University of Massachusetts, Boston's Institute for Community Inclusion.
Was there anything like in your past experience that made you go into that field?
Yeah, so, when I was a kid, I always wanted to grow up and be a doctor. And probably as early as like 5th or 6th grade, that was what I was going to do, become a doctor. And I actually started school at the University of Missouri as a pre-med student with a major in biology. And like so many of us, I learned that I didn't quite have the capacity and the skills to be successful in that field. I struggled with some classes, around genetics and molecular biology and calculus, things like that. But the thing that I always wanted to do was inspire hope and create pride in people's lives. And I knew I wanted to work with individuals that were facing some type of a physical or mental health or cognitive challenge. And so at that time, I was minoring in psychology, majoring in biology. And when I kind of had that awareness that medical school probably wasn't for me, I just flipped my major and my minor and ended up getting my bachelor's in psychology. And I stumbled across a master's program in rehabilitation counseling, and it sounded like something I'd be interested in because, again, it was around inspiring hope and creating pride for individuals that was working with, people that have a wide variety of medical conditions and disabilities. And so it just kind of felt like a natural fit to go into. And so like so many people, we end up in careers not what we initially thought. 2 years before I went to work for Voc Rehab, I didn't even know that Voc Rehab existed. And so it's one of those things where I think allowing life just to allow me to kind of flow through the winds, I ultimately was able to find that career path that, really resonated deeply within me.
It's funny you talk about like you wanted to be a doctor and ended up in Voc Rehab. Well, I wanted to be a teacher. And I realized I can't handle 50 kids at once. So I didn't want to be a doctor, but I feel what you're saying. So yeah, and I'm glad that you ended up here and, you you ended up in this field and we get to work together. So yeah,
It is amazing how life works.
yes. For people with disabilities back in history or back in the days, critical, what was the expectation for them and having a job?
So, excellent question. And it's amazing how, disability employment has evolved, over the last, 100 years, but especially over the last, 35 to 50 years. Really prior to the 1960s, unless you were a veteran, there really wasn't a lot of employment programming for people with, physical, cognitive, or intellectual disabilities. There was definitely a lot of programming that was designed for veterans returning from World War I and World War II that had acquired, a disability. A lot of programming in the 50s focused specifically on individuals with visual impairments. But it wasn't until, the late 60s is when, individuals with intellectual and developmental disabilities really started working in, what we call sheltered workshops, where individuals are paid sub-minimum wages. Those laws first passed in the 1930s, but, ironically, it was more people with physical disabilities early on that were working those programs. But as the 60s started looking at deinstitutionalization and having individuals with, significant, mental health concerns and intellectual and developmental disabilities in the community, individuals started working, at, a lot of these shelter workshops. And as we kind of move forward, it was in the 70s where the Rehab Act was passed. That's when IDEA was passed. And there was a lot more focus around, preparing and prepping individuals with disabilities for life after school. And there was those early discussions about career and career pathways. And then it was really the 1980s is where really, looking at competitive employment in the community just really exploded for all individuals with disabilities. Definitely individuals worked in the community prior to that, but when we do talk about people with more significant and complex, disabilities, it wasn't until the 80s that a lot of the program was started to help individuals in getting jobs in the community. And then it's just rapidly accelerated, as we've overcome some of our biases and stereotypes of what individuals are capable of, and as we've fanned the flames of advocacy for individuals and their families, it really has created a whole new world over the last 20 years of that everyone is able to work in the community and supporting everybody to work in the community.
Yeah, and it's when you talked about the beginning of the time, well, it was focused on veterans and stuff. I remember learning in class, that was surprising for me, is that was the main focus, and then we added on focus on people with disabilities. Yeah. And you talked about the 1970s, but when was the major shift employment?
Yeah, so, I always kind of there's definitely value, and a lot of times I'll go back and talk about things prior to the 70s, but really when we start talking about the community, it really begins in the 1970s with the passage of the Rehabilitation Act of 1973. And that was the first federal law that really set forth some protections for workers with disabilities and precluded discrimination of individuals with disabilities in federally funded and federally contracted employment. It definitely did set the stage of kind of the modern employment rights and accessibility. And then, as I kind of mentioned earlier, with the originally called the Education for All Handicapped Children Act, but later, renamed to be IDEA, that focused on the importance of transition planning and looking at employment post-high school. That really kind of started inviting individuals to begin to dream and to begin to have vision and ensure that school was focused on preparing for people, after work. The 1980s, that's when there was the passage of some Rehabilitation Act amendments that put forth some of the funding that created some of the early supported employment programs nationally as well as in Missouri. That's when we started seeing a lot of kind of smaller community-based programming that focused specifically on individuals with intellectual and developmental disabilities, and really instituted this concept of support employment where you help an individual get a job and then you provide what we call a job coach, to help the individual kind of integrate it into the workplace, kind of learn that job skill. And in the 80s, it was very much a place and train model. So you just put someone in a job and then you just train them how to do it.
Yeah.
And as we've moved forward, it's really about helping discover and explore individuals' talents and skills, and ensure that you have effective matching to minimize the amount of training that might need to occur, once an individual becomes employed.
Mm-hmm. So how did those early program lead to the today waiver funded employment services?
So it was in the 1980s is when the Center for Medicare and Medicaid Services, first began creating what's called the Home and Community-Based Services waivers. I believe that was 1981, if I remember correctly. And so as more and more individuals were being supported with residential supports in the community, other activities around day and developing skills, employment started becoming a part of those Medicaid waiver services. Kind of moving forward, everybody understood the importance of employment. Definitely individuals could always work with vocational rehabilitation, but there was also that understanding and need that within the waiver system, that there were a lot of individuals who had had long-term relationships with people through their residential programming or other day services, and that as opposed to going to a new program and having to kind of reprove yourself, that there was value of working with those individuals who already knew you and knew you well, and definitely there was a lot of complementary work being done between voc rehab and the waivers. But as voc rehab began to run into some financial challenges nationally, there were circumstances where they couldn't support all individuals, and then Medicaid started allowing states to provide the full continuum of employment supports as long as voc rehab was demonstrated as not being available to the individual. And so that's really where the kind of the early footprints of waiver employment programming is in the late 1990s, early 2000s.
That makes sense, huh? Because what book we have, and correct me if I'm wrong, they have 60 days? No, what, how many?
Yeah, so definitely, voc rehab has 60 days to determine someone is eligible for services. And then once eligible, a individual plan for employment is developed, ideally, within 60 to 90 days. But for many states around the nation, they were running out of funds to be able to serve everybody. And so waiting lists began and what's called order of selection. But there was also that need to provide ongoing supports for individuals, even when vocational rehabilitation services had ended or if they just weren't available because of funding limits. And so from that, just kind of organically began developing more and more employment programming through the Medicaid waiver programs.
So what role did Missouri participate in the state employment leadership network?
Okay, excellent question. So around 2009, Missouri Division of Developmental Disabilities became a member of the State Employment Leadership Network. And what that is that's a network of states who are wanting to elevate employment opportunities for individuals with intellectual and developmental disabilities. And it's a collaborative of states, but also the Institute for Community Inclusion at University of Massachusetts, Boston, and then the National Association of State Directors of Developmental Disability Services. And the division started working at that time around 2009 with the State Employment Leadership Network, which we also call the SELN. From there, they did a kind of a findings and observation report to look at programming and barriers that may be limiting individuals' employment opportunities. And since that time, Missouri has been a member of the State Employment Leadership Network, going on 17 years now, I guess.
Yeah.
And from that, they've really helped identify programming and services, looking at what national best practice looks at, helping the division with education and outreach to recruit more providers and to also, kind of elevate best practice of delivering employment programming and services. And so it really just helped, put an exclamation point that the Division of Developmental Disabilities was fully committed to what we call employment first, which is helping individuals with disabilities go to work in the community earning, minimum wages like others. And, understanding that everyone possesses talent, skills, and abilities. Is just a matter of finding that right match for employment.
And being involved with that state employment leadership help in doing that best practice and doing that research help Missouri move forward in that employment post and make sure that we're doing our due diligence for people.
It's one of those things. I mean, when we start talking about disability employment, there's a lot of different units, of kind of implementation. I mean, you have it at kind of your state with the laws and rules and regulations they have. You have it in the types of services. You have to work on the types of services that are available, the skills and the abilities of the individuals. Helping other individuals with going to work. You've got to build the capacity of schools and communities with, looking at new and different pathways and trajectories, for individuals with disabilities. And then you've got to build the capacity and, kind of the vision of families and individuals themselves, that there are opportunities out there. Many times, by the time an individual gets through school, they've been beat up pretty good through the system. They may not have a lot of hope, or they may feel predestined for a certain path. And so it definitely is working with, at all those levels, whether, like I said, whether it's individuals, families, schools, communities, businesses, right up to voc rehab counselors, to, service providers, to businesses, business networks, and then, of course, state agencies and our state legislators.
And you mentioned this earlier, so you kind of mentioned it, but why has it been hard to get people and system fully behind ending shelter workshop or sub-minimum wage?
So, nationally, it's been a high priority to ensure that all individuals are compensated, equitably. And, so there's a big push nationally to eliminate the opportunity for people to work in sub-minimum wage settings. I believe there's 17 states now where they have created state law that precludes individuals with disabilities from being paid sub-minimum wages. Missouri remains one of the 33 states that still does it. Missouri, the last I saw, is one of the top 3 with the number of individuals who are working in sub-minimum wage settings, and also the top 3 of the number of businesses that employ people at sub-minimum wages. And there's a lot of reasons why they preserved. They definitely have a long legacy of creating opportunities for individuals, dating back to the 1960s. When others weren't supporting, but for a lot of individuals that continue to work in sub-minimum wage settings, they've been doing work that they've enjoyed. They've got friends that they enjoy working around. They've got kind of their routine patterns, and so when we work with individuals, we really try and start a new path before they get out of school, of really understanding that there is that ability to work in the community, work in jobs of your choosing, working in the hours that you choose, getting the wages you want. So that way we can create new and different pathways for individuals. But in Missouri, there's a strong support for the shelter workshops. Predominantly, they're in a lot of the more kind of rural communities. I mean, there definitely are ones in Columbia and Kansas City and St. Louis and Springfield, but quite a few of them are in smaller rural areas, and they've kind of created their own community. And so, it really is, I think, just continuing to let people know that I think they had their place at a time. But as we've learned more and more around best practice of helping people with go to work, and as technology has exploded and the ability to accommodate limitations has increased, and federal laws like the Americans with Disabilities Act and others have passed, many states have demonstrated there's not the need for those sub-minimum wage settings, that people can be very successful out in the community, and there doesn't need to be kind of separate carve-out programs. But again, in Missouri, it still continues through, there's been a lot of education and advocacy to eliminate sub-minimum wages. There's been a lot of education and advocacy to preserve those settings. And, it's one where, I think as time moves forward, civil rights always tend to advance forward versus remaining static. And I do believe there is a day and time in the future in Missouri, where everybody will get to pick and choose the type of work they do, the type of setting they're at, and being compensated, above minimum wage.
How does the fact that shelter workshops are under DESE and not Medicaid waiver affect the changes?
Yeah, great question, great insight. In majority of the states around the nation, those sub-minimum wage settings have been historically funded through the DD programs, through some of the Medicaid waiver service definitions, like pre-vocational services or group support employment. Missouri's one of just a couple of states where it is not funded by the Division of Developmental Disabilities, and it does not receive Medicaid waiver funding. And in fact, nationally, with the community settings rule, those states that were funding it through waiver are needing to transition all those settings. But in Missouri, there's always been kind of a budget of general state tax dollars, general revenue dollars to fund shelter workshops. And then there's also the collection of county-based taxes called the Senate Bill 40 that carves out funding that also helps fund those. And so the fact that it's funded through general revenue dollars and through county dollars, it creates a little bit more of a hardship, I think, on some of the education and outreach that needs to be done.
Yeah. So do you have any success stories of organizations moving away from shelter or Section 14C and shelter workshops?
So ironically, I work with quite a few providers in Maryland, and everybody in Maryland transitioned away from sub-minimum wage settings. I'm currently working also with the state of Illinois, and Illinois in 2029 eliminates all shelter workshop settings. And there's been early adopters in Illinois that have already transitioned, as well as everybody, for example, in Maryland and some of those other states. But here in Missouri, probably the two most prevalent examples would be Center for Human Services. They were one of the first shelter workshops in Missouri in the late 1960s, and they transitioned away from sub-minimum wage employment about 5 years ago. And it was one of those things where they had gone to several national meetings. They saw the successes that others were able to have nationally. And, they said, well, why can't we do that? Why can't we make that transition? And as they started visiting with families and individuals and, looking internally, they understood that they could still meet everyone's employment goals, their social goals, and, ensure that they were getting paid minimum wage because it just felt right to ensure that, individuals were treated no differently than anyone else in the community. And so Center for Human Services, they were one of the first ones in the state of Missouri. And then in the Kansas City area, Job One has also been transitioning. Very similarly, they started attending a variety of national meetings. They understood that one of the main reasons for not transitioning is just attitude barrier. It's not having a forward-thinking vision. And I think as they saw that people could be successful and that it's more about the workshop itself, developing the skills and the abilities of how to successfully support people, they began transitioning also. And so, many individuals are, out there, both those agencies working in the community. They learned some individuals really didn't want to work.
Yeah.
It was about just having somewhere to go during the day. And so they were able to meet those needs through other social ways without individuals feeling obligated to have to work if they don't want to work, to have something to do. And so, you don't want people, having to work because it's their only means of getting out of the house. If they're not really wanting to work and they're wanting to do other social things, then, support individuals with being part of their community. So both of them, it all started back to, honestly, just attitude and vision. And I think once you kind of have that vision and challenge yourself to develop the talents and gifts that are necessary to be successful with individuals and working in the community, things begin to happen pretty quickly.
Yeah. I did my internship for my master's degree at Job One, Casey, and when I was there, they were in the beginning stage or the middle stage of transitioning from social work to, so I got to see that happening, and it was pretty cool, and listening from the family and the individuals thoughts of why they thought this is the only thing that they could do, So, yeah. And
one of the things I've always talked about, and that's why, my personal mission statement has always been inspire hope and create pride, because, so often the reasons we've not changed is because of complacency and comfort. It's what we've always done. But when you kind of challenge yourself to say, what can we do? What kind of hope can we create? And for a lot of the individuals and families, what they're needing is hope. I mean, that they've been told that someone can't work in the community, or that they have too significant of a disability, to work. Or, they look at certain aspects, of their daily life and just feel like, well, this person can never go to work, or, they've been around a system of doctors and educators and others who have told them, that they can't work. And so to me, that's why it's always first inspire hope, give people an opportunity to have a new and different vision. And then when they've got hope, then it's having everybody around them rally to turn that hope into pride. And it becomes pride when they're able to achieve that outcome of the type of work that they want to do.
Yeah, it does.
And it's important. I mean, we've got tons of research to show people that work live longer.
Yeah.
People that work have better physical health. They have better mental health, let alone the dollar. We all love money because it gives us the opportunity to go do things. And, so it's one of those things where it's about supporting all individuals to live their dream and to live as long of life as they can, with the best physical and mental health, and that ability to develop new friends, new relationships, have new experiences, and, to have resources to where they can purchase things they want to purchase and go places and do things, because it costs money to survive in this world.
It does, yeah. And that hope is a very big part of that, Duane, is having hope and having someone else having hope for that family member, not just that family member, but both we have counsel or support coordinator. Having that hope is, I think that is very important. And showing them, yes, you've had this for years because your doctor says something or the educator, but they don't know. This is why we have customized appointments or part-time work. You know, we can find a way to, sorry, I'm getting on this soapbox, but we can find a way if you want to work.
Right. And there's a, and again, I don't want to be selling physicians and educators short, but I mean, there's great doctors and great teachers out there that have inspired hope also.
Yeah.
But because of the policies, the rules, planning, things get difficult. And sometimes the easier path is the path that is the less innovative, the less creative, and the less challenging. And so, a lot of times footprints get laid down a path just because it's either safe or perceived to be safe.
Yeah.
Or people are trying to protect others. We got to give everybody that dignity of risk.
Yeah.
I failed as a pre-med student. That was fine. It's like, but that's how we learn.
Yeah.
And so you have to allow people to fail. And it's not trying to overprotect people, but it's allowing natural consequences to occur, and we learn from that. And not always taking the safe way. Challenge our thinking, challenge our vision, and I have yet to see anyone who desired to work in the community. I've yet to see anyone not be successful. And what I used to say years ago when I worked with vocal rehab to my staff was, the first person that you meet with that you feel you can't be successful, let me know and let's talk about it. And let's help you find another vision and another path to where you can support that person. The second time you don't feel like you can be successful, then you and I need to have a discussion, and we need to find you a different career. Because if you don't see success, and I would say that's true, whether you're a VR counselor, a teacher, a support coordinator within the waiver system, or a service provider, if you can't see success for each individual you're working with, then it's time to step aside and let someone else who can take that position, because again, people will be successful if we provide them the support that they need.
I like that saying, that if you don't see success, try again, but come to you and let's give them another person that will see success. It's not the individual, it could just be who's working with them.
Right. Right. And because again, a lot of times we just may not, as professionals, have those skills developed yet.
Yeah.
And so that's why it's like, let's work on developing those skills, or that understanding of customized employment or discovery, or let's help people better understand the type of technology that's out there that might be able to accommodate a person. And so, so you don't want to shame anybody.
Yeah.
But if you continue to feel you're working with people who you can't be successful with, to me, again, that's more of an indictment of your role as a professional.
Yeah.
That either you're admitting you don't have the talent and skills and abilities to help others be successful, or you have the bias that they can't. And I've worked, my 30 plus years, I've probably worked with, over 30,000 individuals, either directly or indirectly. And I cannot give you an example of a person who was not ultimately able to be successful unless they themselves, chose not to be. Or if they made a different decision or a path or something. But as long as they have that interest and passion, and as long as everybody around them continues, to support them and look for new and different ways and try another way, anybody who does that has always been successful. And I've seen people who worked in a shelter workshop making sub-minimum wages that ended up getting bachelor's degree in telecommunication and making $80,000 a year. I have seen folks who individuals thought couldn't interact with others, and it was on a long list of behavior support plans. I've seen that individual go to work and be in customer service where all they do daily is interact with people in the community.
Wow.
Whereas at one time, people thought that they couldn't interact with
Yeah.
people. And so, again, like I said, I've seen a lot of success stories of individuals. And again, to me, again, like I said, it's just inspire that hope, have the vision, and turn it into pride.
Yeah. Yeah. I love that. From your experience, what are some best practices people should know about when it comes to employment, whether that's on the individual or family level? What should providers do differently or at the system level?
Yeah, so I think at the system level, it's making sure that you have programming and laws that really allow and optimize each individual's rights. It's making sure that civil rights are protected and that you've got the types of services and supports that provide those unique needs to enable individuals to go to work. Because for some individuals, they are going to need more support, than someone without a disability. They might need an extra device of assisted technology. And so it's making sure you've got at the state level, the funding and the laws and the programs and policies that enable all the right types of supports that need to be provided. At the provider level, I mean, I go back to saying it's pretty simple. Again, it's having the vision. And, when you have the vision, the body will follow. And, if you've got clarity that all individuals can be successful, then it's a matter of looking at your own agency programs and policy. How do you message to families? But then again, our staff trained in some of the national best practices. And I mean, that truly would be when we talk individuals with intellectual and developmental disabilities, that is a lot of times customized employment. And that's where, you just take the time to really get to know the individual, what their strengths, skills, abilities, and attributes are. You don't necessarily walk into a business with an existing job description. You look at ways to create and customize and carve job descriptions. You look at ways to turn talent and gift into work that may not otherwise, be anticipated. And it's really, just getting to thoroughly know an individual and not having a perspective where you're measuring them against others, measure them against themselves and realize, where their strengths, skills, and talents and abilities are and support them in making choices that truly match with their interests and preferences and talents and skills and abilities. And again, there's a lot of strategy and tools and resources that can help all that. And so, to me, there's no substitute for professional development around customized employment. For families and individuals, I think one of the big things is, for families, to me, I think it's making sure that, starting at school age, that you're always creating those opportunities and expectations, that your child's going to go to work. And it's creating those exposures, of being exposed to multiple different occupations and multiple different, work settings. I think it's helping individuals, look for their own talent and skills. It's giving them tasks and responsibilities to kind of develop their skills and abilities. And it's talking to other families. Yeah. There are a lot of families out there across the state of Missouri that have had to really advocate for their rights of their children, whether it be while in school or whether it be, as they're looking at work. And, it can be exhausting and fatiguing. And I think, talking with other families who have gone through a similar journey just having that support system, but also, learning how did you overcome this obstacle or how did you overcome this barrier? And for individuals, again, I think it's not letting anyone else tell you no. It's not, it's understanding the strength of your voice and exercise that voice, exercise that strength. Don't accept no, push yourself, champion what you want to do and accomplish it. And then, I think also it's important, to have other peers or mentors to look up to. Someone like you, Candace, you know, I mean, I think, I know you and I have shared in the past some of your journey, and there were probably ample opportunities for you to say no,
Yeah.
and to accept something other than what you had envisioned. And, you know, so again, I think it's just important for people to hear others' journeys and what it took for them to continue to move forward down their career path.
Thank you. And I think I appreciate you saying someone like me. Thank you. I need to tell my mom that. No, sorry. I think when you were talking about families too, and I thought about this earlier, one of our good friends, Cassidy Job, who is the executive director of Southern Future Foundation, when I first met her, I don't know how long ago it was, but she said, work doesn't, you have to start at home. You gotta start with the chores, with what they can do around the house, so then they can gain those skills and then move forward. And when you said that, I was like, yes, that sounds like Cassidy Joe.
Yeah, you know, there's reasons why we have tasks with the kids.
Yeah.
That's just because as parents, it's not that we are too lazy to do something.
I thought it was. Oh,
kids. But it's about developing responsibility. It's about helping people understand time management. It's about helping them learn, you know, what all's out there in the world. You know, again, you know, I've done everything from mowing lawns to cleaning house to doing laundry to being a forklift driver to working in a factory to, you know, being a janitor and working in agriculture and everything else. I mean, all of those gave me experiences and exposures and helped me understand what the world of work is, and how to get along with others and how to accept supervision and things like that. And so, you know, again, whether it's household chores or things outside the home, whether it's paid employment, whether it's just observation and doing some community volunteering, all those are important because it shapes our understanding of what exists in our community. It gives us new social connections, and it gives us a better understanding of what we like and what we don't like, and you know, what we maybe can envision ourselves doing for our career.
Yeah, I like that. What is one thing to help anyone that's watching this, whether it's self-advocates, families, or allies, that they can do today to help move their employment post forward?
You know, you know, it's going to be two kind of simple things, but I think one is belief and second is voice. And I think whether it's supporting yourself or a family member, it's first having that belief that they can.
Yeah.
And then it's finding the voice to go out and find and seek and learn and advocate for the programming and services that are needed. You know, similarly, you know, in Missouri, we talked about programming and that there's still settings that are sub-minimum wage. It's the same thing there. You know, I think it's having that belief and that voice of educating others that all individuals have talents, skills, and abilities. All individuals can be successful in work because they are in other states. You know, there's nothing so unique about Missourians, you know, as compared to those in other states, you know, and so, you know, it's having that voice and saying that, hey, we feel like everybody in Missouri should have that ability. They all possess talent, skills. We all need supports in our job. And we all, whether we have a disability or not, you know, we need that support, you know, whether it's a computer, whether it's a supervisor, whether it's training, but we all need supports. We just may need a differing level of supports. But to me, again, it's just having that belief, which comes with expectation, and then having that vision of succeeding, and then the voice to advocate.
Thank you very much, Duane. I know I could tell you this, but I love just sitting and listening to you talk about this and about the history. I know this is one of your passions, so I learn something new every time we talk, and I appreciate you taking the time to share this important information with the audience.
Oh, you're welcome. And, and the reason I have such a strong belief in it, I think is, like I said, I don't want to see any group of individuals constantly marginalized and repressed and kept, at, below poverty levels, which it's where you're at if you're living on SSI or SSDI. I want everybody to be able to go out and perform and succeed in however they want to, and to have the amount of money, whether they want a little or a lot. And I want them to live long, happy, healthy lives, so again, it's about, like I said, it's about inspiring that hope and creating pride in their life.
Yeah. Thank you, and you do. Every time we talk, you do. Yes. Well, I appreciate you taking your time to do this interview today for Candace's Corner, and I will thank you everyone for watching.
Thank you.